Death rates among adults in the 30 days before being admitted to critical care with suspected or confirmed COVID-19 infections appear considerably higher in Africa than the rest of the world. And that's according to a prospective observational study from 64 hospitals in 10 African countries. The researchers say that a critical factor in these excess deaths may be a lack of intensive care resources and the underuse of those available. For example, half of the patients died without being given oxygen, and whilst 68% of hospitals had access to renal dialysis, only 10% of severely ill patients received it. Now, Professor Bruce Biccar from Groote Schuur Hospital and the University of Cape Town, who co-led the research, said that the study is the first to give a detailed and comprehensive picture of what is happening to people who are severely ill with COVID-19 in Africa. And he says that sadly data indicates that our ability to provide sufficient care is compromised by a shortage of critical care beds and limited resources within intensive care units. Until now, little was known about how COVID-19 was affecting critically ill patients in the African continent, as there have been no reported clinical outcomes data from Africa or all patient management data in low-resourced settings. Well, for more on this, we're now joined by the second chair at the Department of Anaesthesia and Perioperative Medicine at the University of Cape Town and Groote Schuur Hospital, Professor Bruce Biccar. Professor, thanks very much indeed for joining us. Why was this study undertaken in the first instance?
Thank you. Thanks for this opportunity. What concerned us when the pandemic broke was that we knew we had limited resources in Africa, and we were concerned about what would happen. And we looked at the literature. We couldn't really find much to guide treatment in a resource-limited environment. So we quickly set this up to try and address it, looking for reasons why patients might die or survive. And we shared the early data last year across the continent to help people guide their management.
All right, so I think we gave some highlights of some of the results, but if you can just take us through your observations and what they tell us.
Well, unfortunately, they're very sad. I mean, the first thing is that these excess deaths in Africa compared to any other region in the world. And then, as you pointed out, only 1 in 2 patients who actually need critical care get into it, and that reflects how little critical care beds we have. And then once they're in critical care, the resources for therapies is limited. So, I mean, 7 to 14-fold less for the severity of disease, of therapies that they get than they should. So those are all extremely concerning, and it's very concerning in a population which is unvaccinated. And I think really this highlights the importance of vaccination. We know vaccinations decrease severe infections. If we don't have the capacity to manage severe infections, then really the population really needs to be vaccinated urgently. We really cannot afford to have a scenario like in India.
All right, so one of the challenges, I'm sure, and I think I saw a report sometime this week that said that the deaths to COVID-19 are probably 3 times higher. And part of that is that there are some people who never get diagnosed but die just because they didn't get to the hospital.
Absolutely. So when you look at our case rate, it's quite low, and I think obviously it means we're missing diagnoses, probably through low testing rates. So we're missing a number of patients who get COVID and die, so they're not documented. And then the fact that, you know, as we see with the critical care beds, the beds are limited, and so people can't access the beds, and similarly, I imagine a lot of people can't access even hospital beds.
So your study looked at people that you knew for sure had COVID, but for one reason or another couldn't get the care that they needed.
Absolutely. So what we wanted is we wanted robust data. So all the participating sites recruited all the patients who were admitted to critical care with COVID were eligible to be recruited, and most of them are in the study. So the data is fairly robust from the hospitals that contributed.
All right. So what do the authorities do with this information? Because it's quite powerful.
I think there are two issues here. So the one is the immediate issue. The immediate issue is, I mean, we can't address the resource limitations for the critical care at the moment. So the immediate issue is really we have to decrease the severity of the illness, and the only way we can do that at the moment is through vaccination. The longer term issue is, I mean, limited critical care resources have implications for all diseases across the continent, and we really need some regulation on what minimum requirements are for critical care in Africa. That's a longer term imperative for policymakers.
All right. And in this chain of care, which area was the most vulnerable from your findings?
I missed the first part of the question. Was it about?
Yeah, I was just saying that you've done this study, and I was just wondering, in this chain of care, which portion, which area is the most vulnerable for people likely to not make it as a result of the issues that you've stated?
I think, you know, the first thing is actually the number of beds. The fact that only 1 in 2 patients can actually get into a high care or critical care bed is devastating. So already half the population, obviously some of them probably weren't sick enough, but I suspect there must have been a large portion who were really sick who never got any care at all. And so that I would say the first thing is we need more beds.
All right. So is it different scales of challenge in different countries, or are we looking at a similar pattern right across the areas that you tested?
So where the pattern is fairly similar across the different hospitals and countries that participated. We didn't really identify any outliers. I think the signal is consistent. Probably the important point to make is that we actually think our findings are relatively optimistic of the outcomes, because we invited 40 countries to participate and ended up with 10. The fact that 30 countries couldn't participate firstly tells you about their capacity. So I imagine their outcomes were worse. Then when you look at the hospitals and intensive cares that did participate, they were predominated by tertiary hospitals and universities. And obviously they got much more comprehensive resources. So all those smaller critical care in smaller hospitals across the continent, I expect the outcomes were even worse. So I think what you're looking at here is the best case scenario for Africa, unfortunately.
All right. I mean, oxygen, sadly, is an issue that we're seeing in India in particular recently. We've got this threat of the third wave here in South Africa. So these factors that you're talking about, are you fearful that they're going to kick in as the winter months progress?
Personally, yes, I'm terrified. I think what we've really shown is that we've got an extremely vulnerable situation, which I suppose most of us knew but didn't realize how grave it was. And really, with the unvaccinated population and seeing what can happen and has happened in India, I think we should be extremely worried.
I suppose, you know, this is an emergency, but can these hospitals be resourced in such a short period of time? Short of which, what kind of interventions might mitigate some of these issues that you have found? Because I'm thinking that, you know, the third wave has hit us in a few provinces already. One can't start building very quickly, I guess.
Definitely. So, I mean, the one thing our study did show is that steroid therapy is associated with survival. So that was from the recovery trial, originally showed that steroid therapy was beneficial, and we saw that across Africa in this study. And we saw it was also beneficial across the different risk groups, including patients with HIV and AIDS. So I think the first thing is ensuring at least that all the sites have access to steroid therapy. That's a simple intervention. Then the second intervention, obviously, to focus on is oxygen.
Okay.
Those are the two things we have to keep our focus on.
Professor Bruce Biccar, thank you very, very much indeed for joining us and helping us understand this important research that you've done.
Thanks very much.
All right, thank you. That was Professor Bruce Biccar, second chair at the Department of Anaesthesia and Perioperative Medicine at the University of Cape Town and Groote Schuur Hospital, talking to us about, sadly, that a lot more people in Africa are likely to die from COVID-19 because we just have challenged resources.